Welcome and welcome Sergei Kondratev. We warmly welcome you here in Swiss Mountain Clinic. This is for myself a deep moment, and we born a partnership between South Center in Cyprus and here in Switzerland and the Swiss Mountain Clinic. I have detected my entire life, more than 35 years, not to illness but to people. And I see progress because with the knowledge people understand why they are sick and what they need to do. And illness for myself is not a condition, because this is a process, a inner voice that knock and knock and knock and calls for help. Sergei, please tell us who you are, what is your journey has been like, and what major advances you are making with Petra's and the SOTSU team in the treatment of neurodegeneration diseases, please.
Thank you. Thank you, dear Dr. Petra. Thank you for having us here in your beautiful clinic. I had a really long journey and it was a bit exhausting, but even the road here, the whole trip from Milano to your clinic, it already healed me somehow. So nice. Now I am full of energy. Thank you. So I would like to introduce myself. I'm a neurologist, neurophysiologist. I've ended my medical education in St. Petersburg in Russia, as well as postgraduate study in neurology and neurophysiology. And then for more than 17 years, I've been working in the big state hospital. It's a combination of the clinical work and research work. And exactly there, I started working with the different types of neuromodulation. And I've joined the Coma Recovery Group. This is a European group with a headquarters in Liège in Belgium. And we worked with so-called prolonged disorders of consciousness. So for this group of patients, we are kind of limited with what could be done. And neuromodulation, especially using TDCS, it sounded like something promising. And we started our work and we finished it, finalized it with a publication in 2023 about treating disorders of consciousness with a TDCS, with some certain results. So I'm the right person to discuss the placebo effect as well, because our patients, they were unconscious, and that means that there was no placebo at all. It's not possible. And then after that, I worked a lot with patients with different neurological disorders, including post-surgical, TBI, traumatic brain injury, stroke, and neurodegeneration, using different methods, applying different techniques. And finally, I heard that in Cyprus there was an idea to start something new. So Dr. Petros, he came up with an idea and he was really passionate to start neuromodulation in Cyprus. And that's how I came to Cyprus and helped to organize the process, to build up a certain algorithm, to build a certain way of how we assess patients, how we customize the treatment, and we started working in this very interesting, challenging, but really promising field.
Beautiful, beautiful. Thank you so much. It's so interesting to know now the background. Tell us, please, what is neuromodulation for you?
For me, as a neurologist, so I would say that in some of the cases I was not satisfied with the ongoing effects of the standard ways of how we will treat the patients, especially with the Parkinson disease, with the different types of dementia, with the different types in general neurodegeneration. So there was always a feeling that we need to look for something else. We need somehow to support our patients, but not to achieve some kind of a short-term effects, but looking forward to achieve the long-term effects. And that's exactly what I feel about the neuromodulation. And I'm really glad to hear that you have here the same way of thinking about something being chronic. So it's exactly what we understand. So we understand it as a brain being in a maladaptive state. It's not just labeling someone with a diagnosis, but it's mostly understanding the disease in a bit different way, in a way where brain is not anymore helping you. It's not building the sanogenesis, but for certain reasons it's stuck in a certain pathological functional state. So for me, neuromodulation is a huge step forward, helping people to achieve long-term effects, to improve the neuroplasticity. For some of the cases, it also may be helpful due to stabilize the neuroinflammation. So basically to slow down the disease and progression of symptoms in general. So I would say that for the moment I understand these methods as a very important part of supportive additional treatment which might be applied, and in case if it's customized with a very good effects and the high profiles of safety.
Since a lot of years on, it was absolutely normal that we at the doctors mean no, nerves and brain and nerve system is not possible to regenerate it. You have another experience now, or?
Exactly.
You understand that this is the boss, this is the chef, and he looked for the structure in my body, and in this moment you have a possibility to reduce inflammation. You spoke about neuroinflammation. You increase the circulation, microcirculation, and you increase the stem cell activity. This is an amazing thing, and not only very, very local, to understand the connection. And this is so great for me to understand, and only what I saw in your work, I visit you, this was amazing for me to see what you change in this process. Yes?
Exactly, absolutely right. So yeah, I want to highlight that with the neuromodulation we are not so much limited with only the neural effects. And yes, we can obtain some certain non-neural effects, working with the BDNF, VEGF, the neurovascular coupling, and speaking about the neurodegeneration and this ability of our brain to restore. Exactly, there was such a mistake, and it was well known in the medical field, and not long ago, by the way, where doctors will say that your brain will never restore. It's not possible.
Absolutely.
But it's not updated anymore. Up to date, you need to understand that it's not that important if you're 85 or 95. There is always a good possibility to build new connections, to have a better global cognitive connectivity, and to improve your quality of life.
And it is not only this treatment alone, TPS. It's a training process which you start with a patient, and you have different possibility for learning, for increase the memory, for reduced inflammation by MS, for example, or?
Exactly. So that's a good thing about the neuromodulation, because you don't work with any kind of a standard prescriptions. So you need to understand your patient, you need to follow your patient on different stages, and as you know, we have follow-ups as well. So we are not so much limited only with a certain amount of in-clinic sessions. Our patients then proceed with a home-based treatment. They are not just using the neuromodulation in front of the TV or computer, so they are doing a certain tasks in case they need a better memory or any kind of being more productive. There are some certain tasks for this, and if we discuss fine motor skills, gross motor skills, spasticity, it's going to be a bit different ways of how we will exercise this, but it's always paired, so it's a combined approach, of course.
Yeah. And can you tell us some examples? For example, I was deep impressed, a guy with a facial paresis. So facial paresis mean that your right and your left body side and your face don't work. And this is a paresis from a nerve. how it is possible that there were only 2 sessions and it was both normal. It was amazing for me. I was shocked.
Yeah.
4 years before, he had paresis on the right side or left side.
Yeah, and thank you for mentioning this. Indeed, we do have some cases we are really proud of. And what is interesting about neuromodulation, that most of those cases, those patients, they tried everything what is available according to the existing guidelines. And still they suffered a lot. They had a lot of limitations of different kind. And for example, we have a patient with a canvas syndrome. So those patients,
What is canvas syndrome?
So those patients, they are unlucky. It's an inherited disease. So they are unlucky to have problems with the peripheral nerves, with the cerebellum, and with the inner ear structures. So basically, they are suffering with a severe ataxia during the day. And it's a situation where basically nothing can help. But with the neuromodulation, we helped a lot. So this patient now, he is not so much dependent on others. He can walk around, he can do some certain things he would like to. He can take care of himself, and it was amazing actually.
Wow.
We have patients with Parkinson disease. Patients with a Parkinson disease suffering with dyskinetic movements after the levodopa intake, and it's a very difficult situation and hardly handleable conditions. Also with the good results, after a certain amount of sessions they will tolerate levodopa beta, and for some of the patients there was a possibility to reduce the dosage. Speaking about this patient you mentioned with the facial nerve palsy, the Bell syndrome, it's probably situations where we can discuss the parabiotic changes in the peripheral nerves. So I would say that it's a kind of a situation when your peripheral nervous system is in standby mode. And with a neuromodulation, you can wake it up, you can integrate it, and finally achieve splendid results.
I remember I had a patient, he is now, I think, 70, but he had as a young guy encephalitis, and since this moment he can't go to the toilet alone. He cleans this every day since 40 years with 2-liter water.
No.
This is the indication, or this is the connection is not well more, or?
This is a situation where connection is there.
10 days,
Yeah.
no stool bowel movements.
Exactly. So it's a suprasegmental dysregulation of autonomic nervous system. So I just was going to mention that connection is there, but this connection is abnormal. So it's a maladaptive state. With the neuromodulation, slowly, if you understand the pathophysiology, you understand the predominant syndrome you have in case of your patient, then you can follow it, and with the neuromodulation we can say that we can rewire it and to obtain the new connectivity, which is going to be more adaptive according to the daily needs. And
Wow.
That's how, because in general for all of us the main idea we would like to obtain is to improve the quality of life. Mm-hmm. By decreasing some symptoms, by improving some certain skills. That's what we are doing with the neuromodulation.
Mm-hmm. Amazing. Another question. When I look about my 35 years, I ask myself why we have not cancer on the heart. I found my answer, because cancer is a problem of the mitochondrial metabolism. We know this since 1930 because Warburg became a Nobel Prize. But when Parkinson started a long time before, you have a sensitivity or you can't smell good. The nervus olfactorius is directly connected with the brain. And when I look my Parkinson patient, this is very different, because one have a big mitochondriopathy. The other, a high intoxication. Nobody speak about the quality of air. We know by the pharmas, herbicides, pesticides. The guys, Thomas Levy and William Cottins, wrote the book Adding Parkinson. They had a lot of hundreds of studies about this. And is this all bells has to be red light when you feel, oh my God, I don't smell so good, to realize this is not a problem of my olfactorious, this is not a nerve, this is a part of my brain, this is a damage on my brain. And this is for me a little bit frustrated that we wait, and then we see, oh, yo, you need Madapar, you have a Parkinson, you have this. And I'm very sad, and I'm so thankful, I'm 67, to see this development in the treatment for all these people, for all this neurodegeneration people. And I would like to help from my side more. And this is for me so amazing, the partnership too, that we have now a key in our hands, or a gift, or which the people can take in their hand. They are not the victim of your life. They are not the victim of the illness. They can do so much now, and they can feel this, what is possible. Or?
Totally agree. And I would say that indeed it's strange. All of us, especially working in the medical field, we know that these are the first symptoms actually. And when we see the patient, we always ask if there were any problems with the smelling, with the constipation, something ongoing,
Absolutely.
So-called non-motor symptoms.
Yeah.
And usually they say yes. But if you will ask, so, and what was the next step? And was there any treatment? Zero, in most of the cases. I don't know why, and I don't know how to answer this question, but I would say that the good thing is that there are methods which we use in your clinic. Exactly this is the right stage to work with this. And it's amazing what you are doing here, and it's amazing how you understand the chronic disease, and combination with your experience, with what you've been doing for these years, helping people with a neuromodulation, might be even a better approach, because that's how we can work with certain brain functional states and neurometabolic programming of our body. And hopefully it's going to be a new step forward due to stop the progression of some certain conditions.
Absolute.
And by the way, what we are discussing now is not so much theoretical, not anymore, because there is a strong concepts, pathophysiological concepts of how these methods work and why they might be effective.
Sergei, you have experience with chronic fatigue. I was 20 years a village doctor, and I had no person, with a fatigue syndrome. So I don't saw this. I don't know when they had a bad accident, a bad illness. They had a long time for recovery and regeneration, and they were fatigued. It's absolute normal, or a big psychological problem. But now we have a big problem with fatigue syndrome. We know why. But is this too an indication for neuromodulation?
It is, because it's easy to express it. I have lack of energy, I have fatigue, but it's extremely difficult to understand what's going on actually, for what reason you do have it. And the modern world, the environment is really toxic, and we understand it. Even if we don't understand it, we somehow feel it. Most of us, we have an inner feeling that something is not going wrong. We are overloaded with the multitasks, with the devices, with the strange food, a lot of things. We don't know, we don't need to count. There were several studies about the chronic fatigue, especially the subtypes after the COVID, so-called long COVID. So the acute phase finished, but then we have a decompensation for a certain period of time. And those studies, especially with the PET scan, they showed that there are some hypometabolic profiles, especially targeting the parieto-temporal region, the right side of the brain. So here we go. Fatigue is not just fatigue. Fatigue is something ongoing with the large-scale brain networks and functional disconnectivity. But why is happening? Brain is reacting on what? On plenty of things which you know better in your clinic, but neuromodulation definitely might be a very good option, an important option due to overcome these symptoms and again build a more adaptive functional states of the brain.
Yeah. Other question, what is with pain and with osteoporosis or bad back pains? Is this too an indication? Because you spoke about, or I spoke about, stem cell regeneration. I only would like to understand.
Yeah, so we need to understand that in general pain is something which is, it's an ancient reaction of our body. It's a protective reaction. Usually we feel pain, then something is going on. Something is going on with our inner structure, something's going on with the skin, bones, muscles, and so on. So it's a kind of indication that we have some problems in certain parts of the body. But chronic pain is a absolutely different thing. So with a chronic pain, we have a different type of a brain connectivity. It's called the pain matrix. So brain, for some certain reasons, starts to be more sensitive towards even normal stimulus coming from the body. And then they are multiplied and we suffer with pain. Pain will trigger the chronic stress. Chronic stress will trigger the high levels of cortisol. Cortisol may suppress your immune system, and then after that, a lot of things may develop. So, thinking about chronic pain as just a simple condition and trying to just prescribe something which will suppress the pain is not the right decision. Treating chronic pain is a combined approach, working with the toxins, working with the supplements, working with the large-scale brain networks. And again, we are discussing the combined approach where neuromodulation can play a huge role. And speaking about chronic pain, for the moment we have a good quality studies, so we can say that there is a certain level of evidence as well. Like for patients suffering with fibromyalgia, we have level of evidence B. So it's a very promising direction for these disorders as well.
You speak about fibromyalgia.
Yeah.
I remember I had a woman and she said, and she called me, can you treat fibromyalgia? And I said to her, no, I'm sorry, I can't. I'm sorry, I can't come. And I said, why? You ask me. I have no treatments for this. I would like to understand why you have a chronic pain. And she came for 1 week, and at the end of this week she told me, I'm so sorry, but the last days I don't take in painkillers, but it was easy. This is only a word. The causes are very, very different. And what I want to understand is when we treat illnesses, it's so interesting to understand. For example, when I see, and we spoke yesterday, that the amyotrophic lateral sclerosis is a very, very difficult disease, and I saw a woman in your clinic that she had this diagnosis 1.5 years ago, and I don't saw this more. This was amazing for me to see what is possible in the beginning of this illness, to understand how important it is to understand why and to do. And I'm very sad to understand how much people we have tomorrow. Parkinson increased. The young people are 24. Dr. Wiechel, I have a multiple sclerosis, and they said, I have to take in the immune suppression,
Exactly.
and this is my life now. And they change, Sergei, they change all, and they would like to know why. What's the matter in 24 years? What can I do? And this is amazing for me to realize and to see, and that we open the minds, that we doctors too, we can show the other colleagues what is possible and what we have to do. Or
I totally agree. I think it's a very good example, which you have just mentioned, about a patient suffering with fibromyalgia, and she contacted you and then asked about the diagnosis. But this is the problem of labeling someone with a diagnosis, because we need to understand that sometimes this kind of things, it's just the top of an iceberg, and the whole problem is somewhere. So it might be not so obvious, and this kind of diagnosis, okay, they're extremely important for the system to calculate the data and to prescribe some certain things, but it's going to be extremely limiting our approach towards treating it, and your patient is a very good example of this. So I would say that in general, when we discuss neuromodulation, most of our colleagues, they will agree that they have, let me say, 5-7% of patients with chronic conditions. They tried a lot of things, but nothing really helped. Exactly this percent of patients could be treated with a neuromodulation. And we can work with a combined approach. We can work with different types of neuromodulation. So for the moment, we have not only the TPS, we have a TDCS, we have a possibility to work with a vagus nerve as well. We can work with the endogenic opioid system of our brain, working with, again, with the chronic pain, with the insomnia and different other disorders. We can combine things, and we can improve the results of the ongoing treatment, even for the cases which were supposed to be chronic and untreatable. No, there is always an opportunity to work.
But why we say this is chronic, Sergei? Why, when we are not interested to understand why the body is sick?
I would say
why?
Why?
And we don't realize the whole problem of neuroinflammation. We open brain barrier. When the gut barrier is open, brain barrier is open, and the whole microwaves open the brain barrier. And this is, in so many cases, a very big problem, that we detected the silent inflammation, and we realized this is brain problem.
Exactly.
And the theater is my body, and this is body language. We have to learn body languages.
Exactly. You have a headquarters, and then you have a service things helping to work with the headquarters. In our headquarters and our brain, we need to have a conductor. So
conductor is a better word. Absolutely.
That's what neuromodulation is doing, the tuning and reducing the noise, and finally to play a beautiful music inside. But labeling with chronic, I would say that I can understand this, because we always try to find the simple explanations. It's something which is more than 3 months. Okay, you have a chronic. What is? I don't know, but it's chronic. That means it's difficult, and so on and so forth. And I really admire that in your work you always focus on someone's attitude towards his or her health. So taking responsibility as well. In the modern world, we would like to depend on something, on a device, on a medication, on the method, rather than think about what we are doing, what we are eating, how we are thinking.
Absolutely.
And so on and so forth.
Absolutely.
And it's really great that you are working, you start actually with this. And then after that...
Sergei, every patient here in this clinic, when she comes in the doctor room, at first he has an examination of the VNS, autonomic nerve system, and we would like to know if you are in a subconsciousness stress modus, or you have a good balance. Your autonomic nerve system is a key for all. And in this moment, when I see there come a bad information in my body, long time, it can be toxins, it can be stress, it can be I care too much, I lost myself, and I had a trauma. My body changed the program of stress modus sympathicus. We know this is absolute another program as a program for recovery, healing, high immune response. You can stay in the night by rain the whole night. When you are in love, there is nothing. You are not in love, you are in stress, you can't sleep, you have stress. You come slowly in a very dangerous situation yourself and your body, and low adrenaline, and the way is free for tumor. The immune response is low, and. This information the body answer with a dysregulation, and from the dysregulation is a dysfunction. This need only time. A very deep, and I was very impressed that I saw that neuromodulation is to care for a high good vagus stimulation and a good parasympathicus program with all what it means to be in a regeneration modus in your body. Can you tell the people how you do it? And
yeah, it's a very important topic, yeah. And in general, we are discussing the homeostatic setup of our body. And sympathetic activity is also an ancient reaction, and we have it for a certain situations.
Absolute.
You cross a road, someone will beep you, and you need to...
Absolute.
Yeah. And I would say that there is a good example when our brain starts to work against us. So in ICU, after, for example, a severe traumatic brain injury, for a certain period of time, someone may be under the prolonged pharmacologically induced coma. So, and we have a lot of stories about this. So nowadays it's well studied. So for what reason? Because in an acute situation, brain starts to be maladaptive or disadaptive in a way, activating the sympathetic response. And by putting our patient in a pharmacological coma, medically induced coma, we switch off the hemispheres, we work with the brainstem, and it helps to overcome the critical period. When we discuss the sympathetic and parasympathetic response in ordinary life, we need to understand that it's not just important, it's an extremely important part for our well-being. And especially if we suffer with a chronic stress or something ongoing with the peripheral system. So with the vagus nerve stimulation, by applying simple looking method. So we basically target vagus nerve through the ear. There is a certain part of the ear which is innervated with the peripheral branch of the vagus nerve. We can activate those fibers which will go to the brainstem. There are two major nucleus inside, like the core, the suprasegmental part of the parasympathetic nervous system, and then our brain starts decoding. It was studied by Professor John Kevin Tracy in New York. It's called the vagus inflammatory reflex. And that's how it could be modulated. So our brain starts to decode the system. It starts to reduce the amount of the peripheral and central neuroinflammation. It starts to be not so much sensitive towards some certain subtypes of interleukins, tumor necrosis factor, and so on and so forth. Mm-hmm. Exactly. And that's how it builds an adaptive state, homeostatic state. Instead of having an allostasis and surviving, you start to live.
Absolute, absolute. And all is a time how long. For emergency situation, absolute, it's protect myself. But when I'm in the stress, the body produced for the people subconsciousness, high cortisol. In the end, the body is fatigue, And you have three things when you have a hypocortisonismus, fatigue, stress intolerance, and your mind is more in depression. So this is dangerous, and we have to understand this. This is life. And for my opinion, and now I think we come slowly to the end, when we understand more about ourselves and we care for us more, and this is trust 1000%, the body can care more for us. And this is so nice, and I'm so thankful and happy for this partnership. Thank you so much. Would you like to tell something, last words to the people?
Thank you so much, and it's a huge step forward for our team as well, because we really admire the way you think, the way you treat the whole team, how you work here. And as being a doctor, it's amazing, because always we try to help people, we try to find the ways, but you did it already here. So those days patients are spending in the clinic, they are changing their certain reactions and their well-being for a long period of time. So I would say that since some of people who will watch this video, they are suffering with a chronic disease, so, or they are in a difficult psycho-emotional state and other things. We have a difficult life. So I would say that we need to understand and think about it, that for some certain reason we're experiencing it. Maybe it's a signal to understand ourselves better, to stop, to pause what we are doing, to focus on ourselves, to understand maybe something is wrong with the simple things. Maybe something is wrong with the way we think, the way we react on situations. And in case we will understand the certain difficult periods of our life as an opportunity to develop ourselves and to understand our inner world better, then it's going to be really helpful, and it's going to be more productive, and hopefully we will achieve a better quality of life with less chronic pain, palsy, and other things which are bothering us. That's what I would like to mention.
Thank you, Sergei.
And sorry to say, just the last thing, all of us, we need to understand that there is always an opportunity. Even though you may have a certain diagnosis and you can search it, now it's easy with the ChatGPT or whatever, and you will see that it's untreatable. There is always an opportunity to overcome certain things and to feel better. Never stop and move forward.
Thank you, Sergei. Thank you, Petros. Thank you, great Sozo team. We have not only new colleagues, we have new friends.
We have the same
and
feeling.
in the name of all our patients and all the patients there outside with all this neurodegeneration, I'm so thankful to see what is possible. And yeah, my best or my lovely word is, a special experience can only be had with a special willingness. So you have to take it in your hand and do it. The key is to do it, the secret. And thank you so much for this wonderful interview.
Thank you. It was a pleasure.
Bye-bye.
Bye.